I am Sayyida Atifa Nuren of BCom 1A, a proud student of Alamari Degree College for Women. I am here on behalf of the college to extend a warm welcome to you. Villamari Degree College for Women was established in the year 1997 by our founder, director, and correspondent, Dr. Philomena. Villamari Education Society is an organized institution believing in fostering a spirit of innovation among students. The college has successfully empowered women to make young women strong and confident by imparting transformational and skill-based education that is intellectually stimulating and academically inspiring. Today, the students of the Department of Commerce of Villamari are here to give you an insight on the COVID-19 statistics around the world. National Statistics Day is observed every year on 29th June to popularize use of statistics in everyday life and sensitize public as to how statistics help in shaping and framing policies. The objective of National Statistics Day is to create public awareness among people about the importance of statistics in daily life and in process of planning and development. The National Statistics Day is celebrated on 29th June on occasion of birth anniversary of India's eminent statistician, late Professor Prasanta Chandra Mahalanobis, in recognition of his invaluable contribution in establishing national statistical system. Late Professor Prasanta Chandra Mahalanobis was an Indian scientist and applied statistician who lived from 29th June 1893 to 28th June 1972. He became first Indian statistician to receive world recognition and is called as Father of Indian Statistics. He had founded the Indian Statistical Institute and contributed to the design of large-scale sample surveys. He is also referred as Chief Architect of Indian Statistical System.
Statue of Liberty.
Ohio,
Mount Rushmore National Memorial. Chicago.
Niagara Falls,
Canada Hockey Stadium. Whistler Village.
This is Canada. Canada has conducted 25,18,650 COVID tests, where 1,02,242 are positive cases and 65,091 are recoveries, and the dead cases are 8,484. This is a statistical map showing number of COVID cases in 13 provinces of Canada. Health facilities in Canada. Here is the statistical map showing number of ICU beds needed in 13 provinces of Canada. Despite spending more on healthcare than most other developed countries, Canada has a relatively short supply of doctors and hospital beds and the longest wait time. Prime Minister of Canada, Mr. Justin Trudeau, announced a new smartphone app which is designed to notify users if they have come into close contact with someone who is tested positive. Here, the graph represents youth surge in April and May with numbers falling. The national curve has come way down but not disappeared. COVID-19 affects age group differently. Look at the number of deaths from COVID-19. For those aged 0 to 19, virtually zero, and above the age of 80, just 4% of the population has 72% of the deaths. Here are the tourist attraction of Canada.
Let us now have a look on the statistics of China, Australia, and New Zealand. We all know that the coronavirus was identified in Wuhan, China. Here I am with a little research on Chinese economy. Like any other economy in the world, Chinese economy has also been affected due to the pandemic. The contraction in Chinese economy caused by the coronavirus is the second contraction after the Mao era in the late 1970s. Now, the Chinese economy has shrunk by 6.8% during the period January to March 2020. Getting Chinese economy revving again is not as simple as flicking a switch. Containment measures to prevent the spread of COVID-19 mean hundreds and thousands of workers have to stay away from factories. Factories that have reopened have been forced to reduce capacity or even close again due to the cratering demand for Chinese exports. However, the Chinese authorities are expecting a sooner recovery of the economy. Here is a video of China. The table represents China's total reported cases, death, recovery, active cases, and the population of China. Australia. The table gives us the numerical data of the total cases, deaths, recovered, active cases, and many more. Now, let's know about the pandemic in Australia. The first confirmed case in Australia was identified on 25th January 2020 in Victoria when a man who returned from Wuhan, China tested positive. Australia's borders was closed to all non-residents on 28th March. Australia had not imposed the strict lockdown that have been implemented in New Zealand and many European countries. This has enabled construction, mining, agriculture, and some parts of the retail sector to continue operating. Social distancing rules were imposed only on 21st March, and the state government started to close non-essential services, but this did not include the closure of business operations. Here is a video of Australia. This graph represents the deaths by age and sex in Australia. By the graph we know that the males aged between 80 to 89 had the highest deaths. We have a good news on this slide. Which country was the first to defeat coronavirus? Yes, you're right, it's New Zealand. Let's know more about it. The table gives us the numerical data of the total reported cases, deaths, recovered, active cases, total tests, and the population of New Zealand. Haven't you heard of women-led nations doing better? Another example goes here. Hats off to this lady. She is Jacinda Ardern, the Prime Minister of New Zealand. New Zealand pursued an explicit elimination strategy rather than seeking to merely suppress the transmission of the virus. It enforced one of the strictest lockdowns in the world, asking everyone to stay at home and allowing only essential services to operate. While this had almost certainly triggered a deep recession, the government says elimination to recover more rapidly. It is taking cautious approach to elimination milestone, however. This graph represents active cases in New Zealand. It can be observed that initially cases reported in the early March was 3, which had increased drastically to 921 till mid-April. Then we see how the cases gradually start decreasing from mid-April to early June and then end up with 0 in mid-June.
India, being a third world country, has encountered a variety of epidemics and pandemics through time. We have been able to eradicate some. Many diseases still continue to pose a threat to the community. It is not uncommon for sudden and rapid outbreaks to occur in India. Many say the cause of this in such developing countries being malnutrition, lack of sanitization, and lack of proper public health system. There have been 13 epidemics that India has suffered since the 20th century, which led to loss of thousands of lives. In conclusion, it can be established that through time many infectious diseases have become widespread due to mere lack of sanitization and crowded environment. The tropical climate and the seasonal rains in India are yet another important factor contributing to several vector-borne infectious disease outbreaks in the past and many more to come. But good medical care and efficient researches have made it possible to fight every infection, and luckily we have been able to even eradicate a few.
Hyderabad is major center for technology industry. The city is noted for its monuments, which includes the masterpiece of Charminar and Fort of Golconda. A recent survey states that risk of community transmission of COVID-19 in Telangana state is 122% and stands in the second position in the country after Delhi. As the central government gave states the power to decide containment, buffer, red, green and orange zones, Telangana government issued a revised list of containment zones in Hyderabad. The list of containment zones in Telangana are Charminar, Khairtabad, Secunderabad, Malkajgiri, Kukatpalli, Rajendra Nagar, Sirilingampalli, Kutubullapur and Maheshwaram. The list of government hospitals in Telangana conducting COVID-19 tests: Gandhi Hospital, Usmania Medical College, Fever Hospital, Nalakunta, NIMS, Institute of Preventive Medicine, Narayanguda, ESIC Medical College, Erragadda, Kakatiya Medical College, Warangal, Center of Cellular and Molecular Biology, Tarnaka, Center of DNA, Fingerprinting and Diagnostics, Hyderabad, RIMS, that is Rajiv Gandhi Institute of Medical Sciences in Adilabad. Telangana government finally allowed private labs to conduct COVID tests. A recent survey has stated that there are 2 positive cases for every minute in Telangana on an average. Average strike rate in the state is 14.1 cases per hour. The number of cases and the strike rate of the disease has shot up since mid-June. Telangana government is trying its best to save the people from pandemic and taking necessary steps after lifting up the lockdown.
Coronavirus came somehow in the Huayan seafood market in Wuhan, which was affected with a virus from an animal. This pandemic has killed more than 3 lakh people of the China's Hubei province. The top 10 countries hit by this Covid-19 are United States, Brazil, Russia, India, United Kingdom, Spain, Italy, Peru, France and Iran. In spite there being lockdown, the number of cases in India were not declining. Now let us see the stats of Kerala and Maharashtra. In this graph, we can see the massive rise in the total number of cases in Kerala and Maharashtra. This is a table of the cases of Maharashtra and Kerala. In this, we can see that the coronavirus testing is done where the care team member takes a sample of saliva or fluids from deep inside your nose and back of your throat with a swab. The samples are then packaged and sent to lab for analysis. If anyone tests positive, then they are shifted to isolation wards to prevent transmission and where they are provided with adequate care. Over here, we can see the situation before COVID where all the places are crowded and at the time of COVID, all the places are deserted.
Maharashtra Health Minister called me and we have a very good conversation up to 40 minutes. And he asked me, Madam, what are you doing in the slums? Here in Dharavi, we are afraid of this Nipah virus. What are you doing in the slums? I said that, sir, here we have no slums like Dharavi. We have some streets or poor people's places in big cities, small houses and small apartments. And it is not like Dharavi. They have ration cards and they have identities and they are living as their own, they are working and like that thing. And if anyone is sleeping in the street or government is picking them up and is providing houses through our life mission nowadays, and we are solving that problem like that. The most important problem or most severe problem of urbanization is the slum formation. Dharavi and Delhi, there are slums and thousands of lakhs of people are living there. They have no proper ration cards. They are, I think they are not in our population register, most of them. They are very poor people. And if the virus entered to that Dharavi, it is too difficult to control it. And I cannot blame the who are governing there this time, but it should be a continuous process from Independence Day itself. We should have to try to reduce the slums, to give few cents of lands or good residing places, houses for the poor people. Long years passed away, and it is not the time now to think about that. Here in Kerala, over the years, we are building this kind of social security measures.
6 countries, 6 curves, how nations moved fast against COVID-19 and avoided disaster. New South Wales, Australia. Australia is rightly regarded as a success story in controlling the spread of COVID-19, and all states and territories are now mapping their paths towards relaxing restrictions in the coming weeks. Italy. Italy was relatively slow to respond to the epidemic. It experienced a high ref for many weeks, particularly in the country's north. Italy followed some of the strictest public health control measures and finally seen the graph fall to below 1. United Kingdom. As in Italy, the result was an initial surge in case numbers. There was a belatedly successful effort to bring down the graph below 1 and a huge death toll of over 20,000 to date. New York. Its graph peaked at a staggeringly high value of 8 before the city had come into complete lockdown. It took a protracted battle to finally bring the graph below 1. Sweden. Bearing a few minor restrictions, the country remains more or less open as usual. Focus has been on individuals to take personal responsibility, and the graph indicates that the curve is flattening. Singapore. It was hailed as an early success story in bringing virus to heel through extensive testing and strict quarantining, with no need of full lockdown. This is how the 6 countries were able to resist the coronavirus even without complete lockdown.
India has suffered 8 pandemics. They are: First cholera pandemic 1817. It was considered as the first major epidemic of the 19th century. In the year 1817, the heavy rainfalls led to a rapid spread of the disease, but the overall estimation of the mortality is not available as the data collection in India began much later, probably in the late 1860s, and the slum dwellers and people in the rural poverty were hit the worst. This was probably due to poor living conditions and personal hygiene. Second cholera pandemic 1829. It started around 1826 from Bengal and it spread through the rivers to various parts of North India. After affecting United Provinces, its impact was huge on areas around Punjab and Delhi. Cholera spread far and wide, all along the trade routes from China, affecting several cities and villages alike. In each place, it lasted for a few weeks and killed hundreds of people every day. Third cholera pandemic 1852. It started around 1852 and lasted till late 1860. It's significant in history because of its spread to countries that were until then not affected. In India, only small spurts of cases were noted in Bengal. It spread to Persia, Arabia, and then to Russia. Fourth cholera pandemic 1863. It began in 1863. It is believed that the infection started to spread from Makkah to several countries. The Kumbh Mela at Haridwar in April 1867 has been considered to be responsible for the epidemic spread of cholera in northern India. The Madras Presidency in 1877 was the worst hit and the cholera epidemic was responsible for about 10% of the annual mortality then. Fifth cholera pandemic 1881. The fifth cholera pandemic was considerably less fatal as compared to the previous four. It was during this pandemic that Robert Koch proved that cholera was transmitted through the fecal-oral route. It spread to United Provinces and Punjab, after which it spread to other countries like Afghanistan, Persia, parts of Russia, and then to Europe. Sixth cholera pandemic 1899. It began around 1899. Major outbreaks were seen in Bombay, Calcutta, and Madras. The sixth cholera brought about surprising challenges. This cholera infection was caused by an unknown non-oven stereotype of V. cholera and spread to many distinct countries, including the United States. The sixth cholera pandemic lasted for about 25 years. Influenza pandemic 1918. Known as the Spanish flu of 1918 to 1919. The pandemic is known to cause around 20 to 50 million deaths. The first episode of disease began in early 1918, India considered to be the foci. Second wave started in Bombay in 1918 and spread to other parts of North India and Sri Lanka, and from there it spread worldwide. Improvement in the virulence and velocity of the virus strain and the monsoon bringing humidity are considered to be the key factor in increasing the severity and spread. H1N1 flu pandemic 2009. The H1N1 flu pandemic began in May 2009 and spread globally by July 2009. By August 2010, it was declared pandemic and around 18,500 deaths were reported formally around the world. 3 strains of influenza viruses were circulating then, of which infection A, H1N1 and infection A, H3N2 viruses were largely replaced by the pandemic H1N1 strain.